Today we're here with Pete Van Runkle, Executive Director of Ohio Healthcare Association. Thanks for being with us.
Oh, thank you. Appreciate you having me.
Now, there seems to be a movement among several NCAL leaders and state executives to expand access to assisted living through more affordable communities. Tell me what you're witnessing that might be influencing this movement.
Well, what we're influencing is that there are a lot of people who can't afford to be in assisted living otherwise without having some governmental assistance. We have had a Medicaid waiver program in Ohio for many years, but it's very small compared to the amount of demand, and that's a concern. I have personal experience with this because my mother was in assisted living and she didn't have a lot of money, and so to stay there for any amount of time, she ended up having to go on to the Medicaid waiver. It's very difficult to find access if you are on the waiver. Most communities will not accept someone off the street, so to speak, who's a waiver recipient. Instead, they will ask for up to 2 years of private pay. My mom couldn't afford 2 years of private pay. I was fortunate in a position that I am that I knew people and she was able to get in. But not everybody is in my position and can do that. And there are a lot of folks who basically either have to continue to stay home when it's no longer safe or end up going to a skilled nursing facility when they don't really need that level of care.
Interesting. Well, what do you view as the biggest challenges facing assisted living, not only on a local level in Ohio, but also on a national level?
Well, really it's staffing. I mean, staffing is the biggest challenge throughout healthcare, and assisted living is no different than that. Now, it's a little bit easier for assisted living because typically they don't have, and speaking for Ohio, but I think this is true nationally, they don't have as many regulations on the staff, on what the staff qualifications, as well as what the staff have to do when they're working in the facility. Things like wearing masks and getting tested and being surveyed all the time and those kinds of things. There are regulations, but they're not as stringent. But still, it's difficult for assisted livings to find enough staff, just like it is for skilled facilities, home health, everyone.
Absolutely, something that's squeezing everyone across the board. Right. What do you believe our nation's leaders and decision makers need to better understand about long-term and post-acute care?
What they need to understand is that there is a huge amount of demand that will be coming along and is starting to come along even as we speak, and that we have to provide sufficient funding for all levels of post-acute and long-term care in order to allow them to hire enough staff to take care of all the people that they'll need to serve. The reality is that the demographics not only are pointing in the direction of many more individuals who will need service, they're also pointing in the direction of many fewer individuals of the age to provide the service. So to allow our members and providers in general to compete for that limited resource, they have to be able to pay competitive wages, and really a little bit above, because it's hard work.
Interesting. A perfect storm, increased demand, but not increased staffing to follow with it.
Correct.
What do you hope to gain from your time here at Congressional Briefing?
Well, we always hope to educate some of our members of Congress or typically their staff about what we do and the challenges that we're facing, so that when issues come along, and there are some now, but there'll be more in the future, so that when issues come along, they will have some grounding in what we do. And also they hopefully would have someone that they could reach out to learn more, which would be us and our members.
Absolutely. Educating and also relationship building.
Correct.
I love it. Well, thank you for spending a few minutes with that. We appreciate it.
Sure thing.